Very good morning everyone. Myself Dr. Manjula. Today's lecture is on matrices, wedges and retainers. To begin with, the word matrices, where exactly they are used. Matrices are used whenever one or more walls of tooth are missing. For example, in complex cavity, like where one or more walls of the tooth is missing. So they help to establish the proper anatomical contour and proximal contacts of restoration without gingival overhangs. This matrix system comprises of matrix band, retainer and wedges. So the word matrix is derived from the Latin word mater, which means mother, because as it comprises matrix band, retainer and wedges, it is considered to be the mother that contains and gives form to anything. So once we achieve a well contoured restoration, how is it going to help in the oral cavity? It helps in re-establishing the proper form of the interproximal space, and it maintains the function of the teeth. Every individual teeth in the oral cavity has got its own function. So the function of the teeth can be maintained by the well contoured restoration, and it ensures no breach in the continuity of the occlusal aspect of the dentition. And also it helps in maintaining the length of the arch, because if any space created by the caries is there in the oral cavity, then the adjacent tooth starts shifting, starts migrating, resulting in reduced length of the arch. Hence, by restoring it in the proper form, it helps in maintaining the length of arch. Then also it prevents impaction of food, and the contoured restoration will help in maintaining and promoting the health of the gingiva as well as comfort of the patient. So all these points, like it re-establishes the proper form of the interproximal space, maintains the function of the teeth, there ensures no breach in continuity of the occlusal aspect of the dentition, and it maintains the length of the arch and prevents impaction of food, and hence maintains and promotes the health of the gingiva as well as comfort of the patient. All these points can be achieved or can be possible only with the help of proper contoured restoration. So for that purpose we require matrix system. Coming to matrices, definition of the matrices. Matrix band definition goes this way, as given by McGee. It is a properly shaped piece of metal or other material used to support and give form to the restoration during its introduction and hardening. Then coming to the definition of matricing as given by author M.A. Marzouk. Matricing is the procedure whereby a temporary wall is created opposite to the axial walls and surrounding areas of tooth structure that were lost during cavity preparation. Moving on to the ideal requirements of a matrix band. Ease of application. The matrix band should be easy to apply on the tooth, and second one, removability. It should be easy to remove as well, easy to apply and easy to remove, and it should be rigid enough. Then it should be able to produce the proximal contours of the tooth. Then it should not react or adhere to the restorative material. These are the various ideal requirements for the matrix band. Moving on to the functions of matrix band. To confine the restorative material while it is hardening, and to establish the optimal contacts and contours for the restoration, to prevent gingival overhangs of the restoration, then to provide an acceptable surface texture for the restoration. So these are the functions of matrix band. Moving on to classification of matrix. Based on the material, matrix can be classified into non-metallic matrix and metallic matrix. Under non-metallic matrix, examples are mylar strip, cervical matrix, cellulose acetate, cellulose nitrate. And under metallic matrix, again it is divided into with retainer and without retainer. So with retainer matrix, we have got ivory number 1, ivory number 8, Toffel-Mayer matrix band, and so on. So without retainers are those matrix bands, matrix system which we don't use retainers. Those are examples are automatrix, T band, S band, copper band, etc. So moving on to individual matrix bands or matrix systems, ivory number 1 and ivory number 8. So ivory number 1, as you can see in the picture, these are used in unilateral class 2 cavities. Wherever there is class 2 cavity unilaterally, we can use ivory number 1 matrix band. So this comes with the matrix and retainer. And ivory matrix 8, it is straight in shape, and it can also be used as in class 2 with no adjacent tooth and MODs, that is mesioocclusal distals, and complex cavities. Also with class 2 with buccal and palatal extensions. Coming to universal matrix or Toffel-Mayer matrix, it was designed by Dr. B.R. Toffel-Mayer, and it is indicated where 3 surfaces are involved. So matrix band, these bands are made of very thin flexible stainless steel, which are available either in roll form or in bands. They are available in 3 thicknesses. You can see 0.001 inch, 0.0015, 0.0020 inch. So in the picture you can see the universal or Toffel-Mayer retainer, where it has got set screw, rotating spindle, slide, head, band. So individually the set screw helps in if you turn this set screw clockwise, it tightens the band and thus secures the band in the retainer. If you turn this anti-clockwise or reverse motion, it helps in releasing the band from the retainer. So that is the function of the set screw. The head part, it helps in accommodating the matrix band, and the open side of the head should be held facing upward when the band is inserted, and while positioning the band around the tooth, the slot in the head should be directed gingivally. And diagonal slot, the slide part has got a diagonal slot. It should be positioned near the head for placing the band in the retainer and positioning it. Then rotating spindle. The function of rotating spindle is used to adjust the distance between the head of the slide and to adjust the size of the loop of matrix band to that of the tooth. Coming to the advantages of universal matrix system, that it can be placed facially or lingually, and it is one of the most stable band and retainer. So the bands are available in for various occlusal and gingival height. Based upon the gingival height, different varieties of bands are available, and usually the small bands are available for they are used for primary dentition, and it provides superior contact and contour and permits easy removal. And disadvantage of this universal matrix system is unnecessary space is created on the other side if used in unilateral class 2 preparation. Unilateral preparation is like sorry, if we restore, if the case is MOD, then you can take it as you can use it for, as I mentioned earlier, the universal Tofel-Mayer system can be used where multiple surfaces are involved. So if only single proximal box is carious, and if you are using this universal matrix system, then the other side, the space will be created on the other side. So this is the advantage of disadvantage of Tofel-Mayer retainer. Coming to seamless, that is copper band, which are nothing but these are used without retainers. So ideally, you can see the picture here. Various sizes of different sizes of copper bands are available, and these are soldered bands, also called as soldered bands, indicated for badly broken down teeth, especially those receiving pin retained they are used especially in pin retained amalgam restorations where there is large buccal and lingual extension is seen. Moving on to auto matrix, again this is a retainer-less matrix system designed for any tooth regardless of its circumferences. These auto matrix bands are supplied in 3 widths and 3/16, 1/4 and 5/16 inch. The medium band is available in 2 thickness of say about 0.0015 and 0.0020 inches, or you can say 0.038 mm and 0.05 mm of thickness. So the rolling of one end of the band over itself is done can be done with the help of hand operated mechanical device. You can see in the picture there is one plier which is nothing but a hand operated device. You can roll the one end of the band, and there is also provision of auto lock loop. As you adjust the band to the size of the tooth, that auto lock loop can be pressed. Then S-shaped matrix. Indications for this S-shaped matrix: it's an ideal matrix system for class 3 cavity preparation, where on distal surface of the canine with either labial or lingual axis is present. For class 2 cavity and for class 4 direct tooth colored restoration and class 5 amalgam restoration. So these are the indications for S-shaped matrix. As you can see in the picture, the canine, it is used on the canine and on the labial surfaces of canine, and the other end of the band is covering the lingual surface of the premolar. That's how it is. It looks like S shape. Since the shape of band is seen as S, it is called as S-shaped matrix. Moving on to T-shaped matrix band. These are used in class 2 cavities, class 3 cavities, and also allows for multiple matrices, and no special equipment is needed. As such, in unlike in the S-shape, we required the hand operated device to lock the band, like auto loop band. So here there is provision of the shape of the band itself is T shape, where the horizontal arm of the band can be pressed over the loop after adjusting to the size of the tooth. Then coming to the window matrix, this is usually not indicated, but except for few wide cavities occlusogingivally or mesiodistally.